substance equals spin. The propaganda's a win, stress feeding on my tension. My countrymen, they love their fiction. Words upon now, it's made with good intentions.
Welcome to 10200, the Independent Politics and Media podcast, midweek episodes where we talk to experts about things that are happening in current events. Instead of doing our usual 6 issues in an hour scramble to try and get through all the horrible things happening on the planet, today I'm joined by an ensemble cast, returning guest John Palethorpe. How you doing?
Pretty good.
Sometimes co-host Angela. Welcome back. And very special guest, President of PATHA, Jen Shields. How are you doing, Jen?
Good, thank you. Thanks for having me.
Thank you very much for joining us. Maybe just quickly to kick it off, are you able to give us an intro as to who and what PATHA are?
Yeah, absolutely. So PATHA, I'm not sure any of us agree on how it's pronounced. We are the Professional Association for Trans Health Aotearoa. So we're a multidisciplinary network of really anyone working to further the cause of trans health and wellbeing here in Aotearoa. So we're made up of clinicians, GPs, nurses, endocrinologists, psychologists, psychiatrists, but also, trans health researchers, community advocates, peer support workers, social workers, really anyone working in the very broad professional field of trans health and wellbeing.
Fantastic. And I guess the reason why we're all meeting on a Tuesday evening is that just a couple of weeks ago, a report came out of the UK, which just as far as I can tell, seems highly unprofessional and politicized, called the Cass Review or the Cass Report, into the way trans healthcare is done over the other side of the world. And that's kicked off, once again, a range of discussions around, I use discussions in pretty heavy air quotes, around trans healthcare and its appropriateness. As I said, it has been somewhat politicized. There are a whole range of problems with it that if you listen to our podcast regularly, you would have heard us go through some of those a couple of weeks back on our current events episode. John, you have an article up with us that you sent through this week. Do you want to touch on some of the bullet points just to attempt to get people up to speed?
Okay, so the thing about the Cass Review undertaken by Dr. Hilary Cass is that there was actually an identifiable problem at the root of it, which was that the gender healthcare service, the gender identity disorder service in the UK was a single provider. So for the whole country, you just had one provider and you had to be referred there from your GP. There wasn't a distributed service. It was segregated essentially, and that effectively meant a huge bottleneck in the system. Now, this is one thing where, we can say that the report itself is rubbish, but the reasons for some of that report are very genuine and very well needed. However, in the interim report, which came, I think, 2 years ago, Dr. Cass was like, look, the waiting lists at this service are 5,000 people, and that is not safe, nor is it it's not sustainable. So what we need to do is close the service and replace it with at least 3 at the beginning distributed clinics alongside pediatric care, so desegregating the system in some ways, and then expand that access, which means more young people would have access to that care. That's all very sensible. And it was welcomed. Families welcomed it because users of the Tavistock Kids Clinic were like, yeah, this kind of sucks that we're having to be on a waiting list for so long. It's not helping our young people. It is causing more distress. However, how that was reported, particularly in the British media and a little bit over here, was very much this clinic that's provided gender healthcare is being closed because it's unsafe. Without going into the detail about what it was that was unsafe about the clinic and just broad brushing, gender healthcare for young people is not safe. Now, I came into this because there was an article in Newsroom saying parents of gender questioning children being let down. And her argument was basically that New Zealand media is not covering the ins and outs of the British medical system, which is very different to our own, in a way that would worry parents. And the way this article was framed was based on a Telegraph article where a lawyer had gone, up to 1,000 families could sue the clinic because their young people have been prescribed puberty blockers or hormones by that clinic. Now, there are some big problems here already. One, GIDS doesn't prescribe. it referred to endocrinology, which is different. 2, in the last decade or so, GIDS has only referred 1,000 or so patients to endocrinology. And a breakdown in the latest CAS report showed that of those, only about 667 actually ever received puberty blockers or hormones. So what we're talking about is 3,000 odd people would go into the clinic. Of them, about 800 would get referred to endocrinology, 27%. And of them, a smaller proportion, 20% of the total 3,000, would ever actually receive puberty blockers. Now, when you look at those numbers and you break them down, it shows that the story which is being told about that clinic and about gender healthcare, that a young person can turn up and say, I don't like what boys like, I like what girls like, and be immediately hit, like jabbed in one arm with the puberty blockers and the other arm with the hormones, you know, is just
If
not
only,
what is happening. So, sorry, what was that, Angela?
I was just saying, if only, like, honestly.
But that story was false, and in order to deal with that story, I was requested politely by the editor of Newsroom to fully go after every single claim, because my initial claim was, man, you cannot trust what the British media say about trans people. They're insane. And I got told, no, you've got to give more detail. So we did. But just to bring it back round to Cass, the Tavistock clinic was not good enough at providing gender health care for the number of patients it needed to do because of the way that the system worked. It needed replacing. However, the Cass review kind of expanded way beyond that and has become more of a political statement than an actual evidenced piece of information. And everyone else on the podcast today can talk about that in a bit more detail.
Yeah, I mean, I just, full toko to everything you've said, John, and mad respect for your work. I guess, I'm mostly here to bring the vibes. We have 2 real experts on, plus Kyle, and then it's just the vibes. But I want to feel like with the CAS report and what it's kind of become is it's a simulacrum of a report, right? It's this sort of copy of an original idea that has sort of become so abstracted and removed from the original purpose that it bears basically no relationship and just kind of becomes this thing that, they've managed to somehow anger everyone simultaneously at the same time, because rather than being an actual meaningful piece of good and needed research, it's kind of become just the report about trans healthcare being bad in a lot of ways. And so I think there is a lot of popular perception that maybe doesn't appreciate the need that existed in the first instance for something like this to happen. But at the same time, I mean, people like Graham Linehan are mad at Hillary Cass as well somehow, because she didn't just call for the lethal injection instead. And I don't know, it's just very strange as a sort of thing. And sorry, that was my entire take.
It's really deeply saddening, and you're totally right, John. The state of trans healthcare in England is so abysmal that, clearly something needed to be done. Alongside the Tavistock clinic itself, the system for adults accessing gender affirming care is essentially the same process. You go see your GP, you get referred to, I think they have a few adult gender clinics around the country, so it's not just one. But their wait lists were up to about 10,000 people, and they were seeing about 50 first appointments per year. It's unbelievably insane the how that system was not meeting the needs of a vulnerable community. Not in the least because, as the more that I've talked to friends in England over the last month or 2 and learned more about how the system works over there, technically, on paper in England, you have a legal right to receive treatment within 18 weeks of being referred, which they are straight up saying, well, we can't do that for trans people. We're not going to do that for trans people. We will just ignore that. And then made hugely more complicated by the fact that for a very long time, every part of your transition beyond, just the social stuff required getting a diagnosis from a gender identity clinic. So you couldn't change your name, you can't have a updated passport. All of these things hinge on the diagnosis of gender dysphoria from a gender identity clinic, which you might have to wait 19 years to see. And instead of deciding to do anything about that system and those problems, they've commissioned a review, which, like John said, initially was about, concerns around safety at Tavistock because of the extensive wait times, that has now been thoroughly co-opted by people who, and it's evident in the language in the report, people who it's really clear that for them, a child growing into a trans adult is a bad outcome. Like anything other than a child turning out to be cis is seen as a negative outcome. And it's flavored the whole report and the approach they've used in the systematic reviews. And you still have, so many trans people in England who are simply unable to access care, and now more in Scotland because of the unethical approach this review has taken. I said I was going to hold back, but I'm not.
I just wanted to chime in that I think it's like an interesting trend that you see in the UK, not just with the Cass report, but also with there's been a lot of court cases about the Tavistock Clinic and its prescribing practices and things of that nature. And the way that things are framed a lot of the time is like, oh, kids who go on puberty blockers tend to transition at like close to 100% rates. And on the one hand, you're like, oh my goodness, this is turning the kids trans. On the other hand, it's like, you have a very selective and restrictive diagnostic criteria. And this is probably actually an indication that you're not giving these to enough people. Like, it's, I don't know. I just think that's an interesting kind of theme where, desistance is only valid as or like, questioning and watchful waiting and whatever is only like a valid kind of treatment method when the watchful waiting doesn't result in a trans adult, basically. Like, it's pretty bleak.
I was just going to say, I had to pull up the numbers, but the report itself has found exactly that. Like, the numbers of people they've found that have detransitioned are astronomically low. And I think you mentioned it in your post as well, John. The numbers of kids who have actually been prescribed puberty blockers are much smaller than the total number of people that have been referred. And it's certainly not an easy process. Like, I think it was on average 6 appointments before receiving treatment. And we have, decades and decades of proof that watchful waiting doesn't work, that watchful waiting leads in terrible mental health outcomes and the deaths of trans people. We've got so much evidence that doesn't work, thoroughly more evidence than we have of any potential harm that blockers might have.
It does feel that, like, I've made that point. I've made the point before, which is, yes, a lot of young people who go on to puberty blockers then go on to take cross-sex hormones, but just think about what has to happen before they get there. They have to go to their families and talk to their families first. They then have to go to a GP in the UK. They then have to get referred to the clinic, then go on the waiting list, then get seen at the clinic and have a psych assessment like you have to do for gender healthcare pretty much everywhere. Then they get referred to the endocrinology clinic, and then puberty blockers become an option. Now, at that point, you will have been assessed multiple times by different physicians, both within the gender identity service and outside of it. So at the point where you are able to access puberty blockers and hormones as a young person, you have gone through so many stages, so much of a filter, that if it's surprising that many young people who get to that point later transition, it's because you found the trans kids. You have found them out of everyone else. Because like the numbers I said were like 3,300 or something, and they actually got about 3,469 young people, but they had to discount some because they had less than 2 appointments. Now, some of that was because they aged out because of the waiting lists. Some of it was because patients kind of get there and go, no. Some kids get down this track and go, actually, no, I'm not transgender. There's something else going on here. And that's absolutely fine. But to say, hey, this is a real concern because you've got all of this gatekeeping in place. These kids have got over all these gates to get there. You've got to really be there for that. And when Angela talked about court cases, there has been one about the Tavistock Clinic. There has been one case about their prescription of and their care pathways. And it was Bell v Tavistock, which, as I put in my piece on 1 of 200, when Kira Bell accessed puberty blockers and hormones, she was 16 years, which means she was consenting as an adult, which is standard medical practice. When she had her double mastectomy, which she now regrets, she was 18 or 20 years old. She made her decisions legally as an adult and later regretted them. And she is one of the very tiny proportion of people who do go through that process. When the initial decision was made about Bell v. Tavistock, which kind of kicked off Cass and a lot of things which now cannot be undone, the initial decision was, the problem with it was that Bell v. Tavistock turned into that case, but initially started off as A v. Tavistock, which was the mother of a young autistic girl attempting to stop her child having treatment after her child had consented. And then eventually the mum, because the child aged up, the mum passed the case over to Bell. That's why Gillick comes into this one. That's why Gillick's there. However, the case got done, and Simon Bridges mentioned it in Parliament during the conversion the conversion therapy ban. He was like, well, what about Bell v. Tavistock and all this? 4 or 5 months later, the High Court overturned Bell v. Tavistock because the judge went, what the fuck are you playing at, messing around with Gillick competence? Of course they're able to consent, and the clinician also has their own judgment in whether they should offer that treatment or whether they think the person can consent, because that's how the fucking system works, you dipshit. Paul Conrath, who's the lawyer for Bell, massive anti-abortion lawyer, he has tried to do some wild shit. Like, I suggest you look up this motherfucker. He's a real problem. He went to appeal to the Supreme Court, and the Supreme Court went, the Tavistock clinic made no error in law. It made no error whatsoever. Everything it did was completely and utterly legal and within the boundaries of the care pathways that it has established. And they said at that point, the judge in the previous case should have said, well, there is no arguable point of law here. But that didn't happen. And that's why we ended up with the Cass review. And that's why we've ended up where we are right now.
I think it's really valid and useful to be talking about Gillick competency, and because I think that links to like something that's really worth keeping in mind around this whole like anti-gender affirming care project, and they're really going hard on trans young people in particular because they're kind of the most vulnerable of us, and the area where the general public is most likely to be like, oh yeah, that might be concerning. But like you say, Gillick competency is also what enables young people to access, reproductive health care when they need it without parental consent. And Erin Reid, who's an incredible journalist based in the States, has uncovered a relatively extensive history of Dr. Hilary Cass meeting with politicians in Florida who are working to ban gender affirming care, and then similarly also working to ban abortion further. So this attack on gender affirming care for young people in particular is like this wedge issue that is a really easy way to drive these far right ideas into the popular sphere.
That Cass thing with the guy who helped craft DeSantis's trans ban is a lot worse. And I know that Eric covered it, but it was Cass was introduced to a Catholic lobbyist guy by the head of the Finnish Institute, whose trans healthcare protocols were one of the few which were seen as good enough for the York study, which was created solely by the same person who introduced Dr. Cass to the DeSantis trans ban guy. And you go, well, hold on a fucking second. Whoa. But again, won't get reported on in the mainstream media, because when you say, hey, have you noticed all these people are quite anti-trans? They go, oh, well, that's just because you want to trans all the children.
But these are the people who are involved. Like, I'm going to butcher that person's name because they're Finnish, but Rhetoric Aotearoa is who John was talking about, I'm pretty sure. And as one of the members of the advisory group for the Cass review. Sometimes talking about this makes me feel like a conspiracy theorist, because it genuinely is all connected. It is the same people pushing the same harmful rhetoric around the world. But like it's there. Their names are on the reports. It's documented. It seems so blindingly obvious.
Yeah, I mean, conspiracies exist, right? It's people coordinating, sometimes in dark, shady rooms, sometimes just on the telephone to push an agenda and to organize in a specific kind of way. And a lot of this is evidenced. We have the receipts.
Yeah, I guess actually kind of like question for you, Jen, as somebody involved in, like PATHA, which is the National Trans Health Association here in Aotearoa, which I understand like the way that I guess trans healthcare, like discourse and dialogue and research kind of progresses, right, is that you have this national body called WPATH, the World Professional Association of Transgender Healthcare. And they sort of release like best practice kind of standards, things of that nature. And the research that they look to find and develop what they consider to be international best practice is research that comes out of sort of national professional healthcare associations and things of that nature, right? So in terms of like, because again, this thing with everybody sort of having these connections who's kind of involved in this. And on the one hand, it's like, well, it seems insane that this small group of people, But I mean, my understanding is that this is a small field, right? And that, there are people who are very actively involved in, like trans healthcare who are not necessarily fans of the transgenders. And yeah, I was just wondering, like being involved in PATHA, like have you been to WPATH? Have you, like things like that? And like what's kind of like the size and the nature of this like professional community that, does this kind of work?
Yeah, I think like you're right. It's a relatively small field in the scheme of things. Like it is growing, and you're totally right that internationally and historically, the people who have been most involved in trans healthcare weirdos who don't like trans people, which I think is part of why the current pushback is so strong, is because what's happened is that trans people have said, actually, we don't want these creeps being so involved in our care. I can only really speak to New Zealand and Australia. I haven't been to WPATH because I'm not rich enough for international travel, despite what some of the creeps on the internet think.
You're not making the big bucks?
No, I'm not in control of the government. I'm not in control of the police or the education system. I don't have the hookups.
We've got to give you some of that left-wing independent media money that we've got
Yeah,
rolling
exactly.
around.
Spending billions of dollars on institutional capture.
Yeah, exactly. Apparently I've done that for free, so who even knows? It's so hard because when I think about the numbers, the communities are probably quite small. But at the same time, when you're in it and working in it, they feel rich and they feel full and they feel diverse and they feel like I just get to work alongside and meet so many people who are really passionate about this care, who aren't creeps, that totally counterbalances all the weirdos who we have had to deal with. In the last couple of months, through all this, I've been lucky to engage more closely with some of our colleagues on the other side of the world, and it's been a really nice silver lining from managing all of the damage and harm that, reports like the Cass Review have done, has been able to strengthen those international alliances.
John, you mentioned when you were kind of giving us a background on the Cass report and Bell v Tavistock that Simon Bridges stood up in the House and referenced the court case. How indicative is that of the way that this coordination works across jurisdictions? Because that seems a pretty out the gate thing to be doing, given that I imagine it was already lining up for appeal at that time, and the ruling was pretty controversial to begin with.
I got incredibly shitty with him in the select committee about it, because in the thing he said, a parent should be able to say, well, hold on, let's wait until you're 18. And I was just like, for puberty blockers? And he goes, well, yes. And I was like, if you wait till 18, puberty has happened, Simon. And he was like, well, no, that's not the... Okay. And it showed a fundamental lack of understanding on the subject, but that is no barrier to reactionaries adopting anti-trans rhetoric. It really isn't, because this was about conversion therapy, and it was the same argument that is going to be had or is being had in the UK right now, which is they haven't banned conversion therapy yet. And Dr. Cass, the day after the report came out, went to the Equalities Minister and stuff and said, hey, be careful you don't accidentally ban gender exploratory therapy, which is a nice long way of saying conversion therapy, which, by the way, is supported by one of the only clinical psychologists who did the assessment of the academic literature, which is the foundation of the weak evidence thing. Her name's Dr. Tilly Langton, or Trilby Langton. That's her first name, which is a gender-ass first name, being called Trilby, I've got to admit. Like, before she was appointed to work out the methodology and how the study would work, She went with some of her friends to lobby the Equalities Minister against banning gender exploratory therapy. And she was the only clinical psychologist with experience of having worked in the field who was on that academic review. Again, I sound like I'm mad. I know it. But you can find the evidence of all of these things. They're very clearly laid out. There are records. And yet it's not reported on. And this kind of deliberately not seeing things is very British. They love not seeing things. Every crime the Empire did, for example, that I simply refused to. But we're also seeing it here in the attempts of people to inject the UK's debate into New Zealand. That article I talked about in the piece I wrote for you guys, the main thrust of that piece was, we don't know if New Zealand's gender healthcare system is set up the same way as the British one, except we do. Because you can go to the Manatu Hauora website and you can see everything. You can see the consent forms. You can see the clinical guides. You can see everything. But this person, who I believe is a doctor in public health, wrote an opinion piece for Newsroom saying, we don't know if this is the same here as it is there. That is a massive professional bit of negligence. Like, if it's a negligent choice, or it's an even worse deliberate one, I couldn't possibly comment on that. But this not seeing things, I mean, I don't want to talk about Damien Grant too much, but there was one thing in his horrible opinion piece which I thought was very, very rare for somebody who's doing the just asking questions, or we should be ashamed of ourselves. He admitted in that piece, Dr. Hilary Cass found no evidence that puberty blockers are harmful. You will not see that reported in the UK press anywhere. You will probably not see it reported in our press when the Ministry of Health come out with their own evidence brief. But Damien Grant, for all his contrariness and his horrible cigarettes and his bad attitude, did at least front up and say, yeah, there's no evidence these things called harm, actually. And again, it's this not seeing things, deliberately not seeing them to concern the wider cisgender community. To say, ooh, trans healthcare. It's a very unknowable field. It's a big black box. We put your kid in the black box, they come out a different gender. And these are professionals. I'm sorry, the black box technology is still in development.
One day,
one day, click of the fingers. But it is that the way that it's set up is first making claims which are completely unevidenced. Secondly, pretending you don't know stuff that's publicly available. And third, going for the cheapest, nastiest trick, they're coming for your children, which is just 1980s homophobia recycled again. Like, puberty blockers are the new kind of AIDS panic. You know, they're going to give your kid this thing, and this thing is going to change them, and they're not going to be your kid anymore. And it's horrible.
On that note, I was wondering, we've been talking about Gillick competence a bit, and we sort of referenced what it does, but I was wondering if it'd be helpful, like, just for the average listener, to like talk about Gillick as a case itself, as a piece of law. So Gillick itself is a piece of British law that was ultimately decided by the House of Lords, because that's a thing that they do. But basically the facts of the case were that there was I believe a 16-year-old girl who was from a Catholic family, and she had begun to be sexually active, and she approached her doctor for birth control. And the doctor was like, let's discuss this. I'm making an assessment of basically, do you understand the risks and outcomes of this treatment? And, do I think that you're capable of making this decision? I do. And then, so the doctor prescribed this girl with contraceptives. And the mother got incredibly mad about this and initiated this litigation that got all the way up to the House of Lords, which is sort of like the British Supreme Court in many ways, or was at the time. Specifically because she disagreed with this idea that her teenage daughter who was having sex should be able to access contraception. She would have loved, I guess, for the daughter not to be having sex, but that was not a thing that she could change by lawsuit. And what she chose to try and do was to ban the prescription of this medication to this person of this age in a sort of like individual, like abstract sense. And so when we talk about Gillick being under threat, I guess that it's like all pieces of case law, it's a really sort of like, we talk about it in the abstract and we sort of talk about the things that it does. But I think that the idea of Gillick being under threat, I think, is something where it's one of the rare like leading cases where it's worth going back to the actual scenario that it started at, which is again like teens who are old enough to be sexually active wanting to access contraception so that they don't get pregnant, and fundamentally somebody trying to move heaven and earth to get the system to ban that. And yeah, I don't know, does anyone have a thought or a take on that? Because I think that, yeah, in light of, as you say, the sort of like, again, particularly in Bell and Tavistock, and I apologize, I sort of talked about many court cases. What I should have said is that it was appealed like 1 trillion times, which is hugely expensive and a very like arduous process, which shows you that the people behind it were very committed to it as an idea, I guess. But yeah, so it initially, as you said, it resulted in this ruling that, this couldn't be prescribed to somebody under 16. Now, the way that Gillick was initially decided as a case was that they like very explicitly, in multiple bits of the sort of like concurring judgments that were issued by the Lords, they very explicitly say there is not a set age. And this case is not trying to define a set age. We think maybe 16-ish, but fundamentally it's about two key principles, which is the patient able to understand the outcomes and risks of a treatment? And in the doctor's professional assessment, and doctors who go to university for like 90 billion years, in their professional assessment, do they think that the child is capable of giving consent to get that medical treatment? And so, already, as you sort of mentioned, John, in the first sort of cut at what became Bell and Tavistock, you have this hard and fast rule, which is explicitly against the law. The sort of leading case that has ultimately decided all of this, right? Which is that there is not a hard and fast rule. These things are complex, and actually we need to defer to the expertise of doctors, because we are judges or lords, I guess, making law, and we are not actually experts in this field. And so, talking about Gillick being under attack sort of by these various appeals is, I really want to bring this home to people, I guess, about the connectedness of this issue, because, the trans community is, we're growing, but we're still in that growth stage, I guess. Like, it's a very small community that has been repressed for a very long period of time. I looked up the other day, I found a OAA request linked to a horrific column that I read in Don Brash's blog, but it had the numbers of like kids actually on puberty blockers in New Zealand. And fun fact, there are more kids at Waitaki Boys High School in Oamaru than there are kids on puberty blockers in the entire country. So like the group of people who are initially, I guess, affected by these sort of really troubling developments that we're seeing in trans healthcare overseas and kind of internationally that are happening, like it's a very small group that are at the thin end of that wedge. But that wedge leads directly back to like, do you think your son or your daughter should be able to access contraception? And that is immediately where it goes. Once, if this sort of pushback is successful in its initial phase and they manage to, sand off the 400 odd children in this country who are on this treatment, right? If that gets, sanded down at the end of the wedge, then this is what the next bit to become exposed and to become, eroded away is. And so, yeah, I guess just with all this talk together, I just kind of wanted to chime in with that for people who maybe are not as nerdy about this shit as I am.
I think that's really evident in looking at who the people are in Aotearoa that are really kicking off about caste and all this stuff. And it's Destiny Church, to no one's surprise. It's what I've started calling the anti-trans lobby in the hope of socializing that language, because that's what they are. Groups like GenSpect NZ, who is just one famously ex-Green Party member.
It's Janet, isn't it?
Yeah, it sure is. It's Speak Up for Women. But I think the person who has been the most active around this stuff, who is producing basically a podcast a day about puberty blockers at the moment, is Bob McCroskey from Family First, who this week is going absolutely crazy because one of the people who has peer-reviewed the Ministry of Health's evidence brief is a gender-affirming doctor down here who also works very hard to improve access to abortions. And I am so curious and perpetually perplexed at how people who position themselves as outright feminists could possibly conceive to be standing on the same side as someone who, in the same sentence, is saying that both puberty blockers and abortions should be banned.
And it's the same here as it is in the UK. It's just that we do not quite have quite as toxic a media environment yet. But that's a yet. It is Bob McCroskey, it is Reality Check Radio, inshallah they never come back on air. It is all these same groups, and it is, like you said, a lot of people who say, well, I was left, but then the left went to trans, but I'm still proper left, going, hey, Family First have done a poll with Curia, and look, it says that we're winning. I mean, there is one point about all of this, about the BDMR and the CPPL and stuff, which is the anti-trans lobby fucking lost. Like, we had to fight twice as fucking hard for the BDMR because the New Zealand First Minister, Tracy Martin, kind of tried to just kill it effectively. And like, we've gone through the details on that before in the past. And with the conversion practices thing, it's funny that once you get out of listening to Bob McCroskey and people like that, and you get it into, say, the parliamentary arena, most New Zealanders look and go, yeah, we should ban that shit. It's really bad. Or, yeah, trans people should be able to change like literally one piece of paper to match all the other ones they can already change. And there isn't a massive problem with that. People just go, oh, yeah, actually, yeah, fine. I think Chris Luxon voted for banning conversion therapy and the BDMR. He's the Prime Minister. Like, that stuff it's not locked in there, and it's always going to be slightly under threat as long as these groups exist. But there was cross-party support for both those pieces of legislation, despite a very suspiciously well-funded effort by the anti-trans lobby to knock it off course. They are hanging their hats that the upcoming evidence brief sparks Dr. Retty to do a CAS review of New Zealand's gender healthcare services.
Probably a good point to kind of open up on that as well. We've done a lot of the historical stuff, but where are we right now? We're starting to see that anti-trans lobby get a bit more vocal again and make their way into mainstream media with some either negligent or intentionally misleading information. John so diplomatically put it. But what is the current state in the New Zealand system and the way that CAS is going to potentially kick things off here?
Yeah, so I think the release of the CAS review is one of the things that has kicked off the anti-trans lobby here in Aotearoa in particular. Like, it's very evident that there is some international as well as local strategic coordination around this. Like, in the weeks following the CAS review, we saw Conservative legislators in a number of states across Australia, as well as in Europe, introduce motions calling for inquiries. There's just been one in Victoria earlier today. But like, a number of those happened on the same day. Like, there's clearly some coordination here.
They're not trying to like hide it.
No, absolutely not. No. So the state of play at the moment, the Manatu Hauora have commissioned a evidence brief into the use of puberty blockers for gender diverse young people here in Aotearoa. Essentially, it's a systematic review. It was due sometime last year, but initially the terms of reference they laid out were specifically looking at the physical impacts and not the mental health benefits, which would kind of be like commissioning a review into psychiatric medicine and being like, what does this do to your body, but not look at what it does to your mind. So those terms of reference were updated, thankfully, and then it was pushed back, and it has been in a state of delay for some time now, where it could be any day at this point. And Manatu Hauora have also written a position statement to go alongside it. It's a systematic review. If they've done it right, as a systematic review should. We will have a fair idea of what it will say. It's likely to say that there's, limited evidence for both the risks and the benefits of puberty blockers. And we do have data about how many young people are on blockers here in Aotearoa, like you said. And that's the favourite anti-trans calling line at the moment is, why are young people prescribed 10 times the rate here in Aotearoa? And it's because we have a functioning healthcare system that doesn't have, 10,000 people on the wait list for 50 appointments a year. Like it's.
Oh wait, so we do know. We do know if it's the same as the British. Oh right,
We
I get it.
absolutely know. You could ask the ministry, which they have a number of times through extensive OAA requests.
Literally, our system
yeah.
is kind of set up the way that Cass indicated
Yes.
the British system to be set up. She didn't say this in the report this year. She said it in the report 2 fucking years ago.
The interim report, I remember at the time, pretty much exactly outlines the model of health we have here in Canterbury, which felt like a nice win for us. And, the rest of the country has a pretty similar system at this point. We've got a really good spoke and hub model of care is the trendy language, where no matter where you live in the country, there'll be a centre somewhere close to you that you can go for care, and that centre can access specialist advice when they need it, and you can access this care through your GP. And in some places, there certainly is really patchy access, and that's something that needs to be improved. And in other places, we definitely do have some wait lists, and that needs improving too. But the state of play here is that we have much better access to healthcare and a much more holistic approach to healthcare that genuinely considers, all of our health needs, including our mental health and social support needs, that by all accounts is functioning, not at its best, but what part of our health system is. That's not specific to trans health at all, although we do see some under-resourcing that I would love to see fixed. But
That's real equality, isn't it?
yeah, everyone gets treated the same amount of shit.
So we know broadly what this review should be coming back with. You say it could be dropping any day. What are we liable to see coming down the line from anti-trans campaigners? You said in Australia they had people in positions, like elected positions, who started motions, so trying to kickstart legislative processes off the back of the Cass review happening in the UK. Don't think we've seen anything like that here yet. What has happened in Australia on the back of that, I guess as a kind of analog to us, also being on the other side of the world from the UK, and how much of that are we likely to see mirrored in the New Zealand experience?
Yeah, so we've worked really closely with folks in Australia. So before PATHA was incorporated in 2018, we were part of ANZPATH, so the Australia-New Zealand Professional Association for Trans Health. So we've got a really good relationship there. And just in November last year, we had a combined conference in Melbourne. So we've got some really strong relationships. And that meant that when we knew that the Cass review was incoming. So yeah, some incredible people over at the Trans Justice Project in Australia did a lot of work at kind of pulling community together to provide a bit of a coordinated response and share resources, because if there's one thing that's true around the world is that trans community organisations are under-resourced. So it's nice to be able to collaborate and not duplicate that work. And yeah, I think that collaboration has been so beneficial, like not just for my own mental health, knowing that we're not in this alone, but we have the benefit of time zones to our advantage. So I think like Cass dropped at a really unusual time. We were expecting it a couple of days later, and I think they chucked it on the website probably at midnight on the .uk time, which conveniently is middle of the day here. So we were able to pull together a response that in some ways kind of set the tone for how trans communities were then able to respond around the world, which was really great. I think what we'll see in Aotearoa when the evidence brief drops is more of the same of what we've seen so far. Certainly we're going to continue to see calls from the anti-trans lobby for some kind of review or inquiry or ban. We've certainly seen press releases and petitions to that effect so far. I kind of don't want to give them any more ideas any further than that, but there are we're definitely preparing for a whole range of different possibilities. And yeah, I feel like if there's one thing that this constant kind of delay cycle has done is that, we've been able to be really strategic in our planning and thinking. So I feel pretty prepared to be able to, pull together some advocacy pretty quickly when it does come out.
there was also the response of Australian politicians, and especially those, not those who are in the opposition putting down these motions, but the ones who are actually responsible for care, because it's federalized over there, isn't it? It's states, individual states, and you had health ministers from each state going, yeah, the way that the UK system set up was really fucked up, but that's actually got nothing to do with how we run it, and we're really proud of our gender healthcare. No, we will not be changing what we do with puberty blockers because we know what we're doing is working. And the fact that that came right down from the federal government minister just going, look, they know what they're doing, was pretty incredible, because it was almost immediate. Someone at the Australian Guardian was like, hey, what does CAS mean for Australia? And Australians just went, it means fuck you, that's what. And it would be great if our government did something similar. And I believe that Matt Ducey may take that line, who is, he's the national guy who doesn't appear to be a national guy. He doesn't know which party he's in. But Matt has already been targeted by the anti-trans lobby in this country because he was a mental health professional, and he did work at the Tavistock clinic, but he did not work in the gender identity disorder service. He didn't work in GIDS, but that doesn't matter to them. What matters is that he worked in the building, so he's got trans radiation, and now he's kind of turning into some kind of like pro-trans Hulk who is going to destroy the anti-trans movement, inshallah. But kind of, we've got an example of the government saying, yeah, it's got nothing to do with us, our system's completely different. How busy do you think our government currently is? Do you think they've got time to do culture war stuff right now? Tanking in the polls, budgets on the way, everything's getting a bit colder. Yeah, do they just go, yeah, actually the system works fine, like, fuck off. And it's another big fat L for the anti-trans lobby, Not that it'll shut them up.
Yeah, sorry. I guess off the back of that as well, I wanted to say, I think in terms of like where we might expect to see some backlash coming, I guess I referenced earlier a pseudonymous, not sure who wrote it, article on the blog of famed libertarians Brash, Bassett and Hyde, rather, saying that Matt Ducey has a conflict of interest and should not be allowed involved in any trans care, nor should any trans person, nor should any person with a trans relative. So I think in terms of, I guess, the tenor of the worst of it, which, Bassett, Brash and Hyde, but the tenor of the worst of it, I think, in terms of like what the risk of what we might see, I think it's going to emerge from the corners and the circles, I guess, in which those three guys swim. And it's going to radiate outwards from there. And it will be, they might be able to temper the tone a bit, but I think that there is a level of just extremity in it. And hopefully the New Zealand public will listen to people saying stuff that, like from a conflict of interest management perspective alone is patently bananas. Hopefully they will see that and go, yeah, not really for us. What's this government actually doing for us? But yeah, if there is a negative response, I guess, to upcoming developments in Aotearoa, that is certainly where I'd look towards in terms of, I guess, where this will, again, like radiate out from, in terms of, the former politicians who can say the things that they kind of want because, they're not in office anymore. And then it's, okay, well, who reads these esteemed thought leaders?
You do. And you warn us about them.
And we hate ourselves for doing so, yes. There is also another little bit here, which is the what PATHA did and what OzPATHA did mattered immensely. Like you said, Jen, you got ahead of it, and it did go around the world. Now, a lot of the fights that people in this chat have been involved with to get us self-ID, to get us conversion therapy ban, are not just ours. People watch us from overseas and they go, fuck, how did New Zealand do that? And we say, well, partly it's because we're a small population, so it's much more likely you actually know someone who's trans or non-binary for a start. And people are just like, that small C New Zealand conservatism thing where people are like, yeah, it's your life. What the fuck's it got to do with me? Which works for us in this sense. But I heard your statement being read out on British podcasts by people going, it's really great to hear this sort of thing. I heard an absolutely shocking pronunciation of Aotearoa by famous YouTuber Abigail Thorne, which my goodness, I love that woman dearly, but my God. But what we're doing here matters, and we are ahead of the game. Like working with those groups over there, or just being able to be this shining light and going, no, we're not having this, and here's why. Especially because our legal system is founded on pretty much the same principles as the UK's one. We run under the same like precedent case law, things like that for a lot of the time, yes. However, I do also want to shout out Debbie Ngarewa-Packer, who has got in the biscuit tin, has got a bit of legislation to put gender identity under the Bill of Rights Act. The last person to try and do that was Dr. Kerry. She was having a crack at it.
It's the same
But
bill.
also before that, it was Fire Georgina, and they had to get the AG out the next day to say, no, it's definitely covered because Helen Clark's government was too afraid of doing this thing that was progressive. And I'm so glad Labour aren't like that anymore.
Well, they're not in government, so it doesn't fucking matter.
Were they ever?
Whoa. Wow, John. No, it's fine, everyone. We're pro-Labour. No, we're not. Who am I kidding? Who am I kidding?
Boo, boo.
It's, really, really interesting to hear the way in which that dropped at midnight in the UK, and so we were able to pick it up kind of with a half a day of working hours left. Is that something that feeds back into the New Zealand community here as well?
Yeah, I think so. Bold of you to assume that I just work during the day, though. Yeah, like I think I really do think how prepared we were able to be with that really meant that like I don't want to get too up myself here, but I feel like that contributed to, how little it landed with mainstream media here. Like
Hey, take the wins.
Yeah, thank you. By all accounts, the case review has bombed as it should. And I think we've had maybe 2 or 3 stories on it and an opinion piece from an Auckland businessman who we should all bow down to as the expert of gender affirming care by all accounts. I think we're really well placed and really able to set the tone of conversations around this. And I'm really proud of the work that we've done here in Aotearoa, like not just around this, but like of the work that we've done around gender affirming care in general and trans wellbeing in general. And you're right, John, like people look at it around the world. Like in the last couple of months, I've had the huge privilege of meeting with trans advocates in Ireland who are trying to do similar things around pushing for an informed consent system because they have a really similar arrangement to England in that there's one clinic that is essentially holding the country by force, restricting access. And just the ability to be able to share what's worked for us here and to be able to do what we can to kind of spread that work around the world. And I think it's a credit to the quality of the care that we provide and the quality of the system that we have. And that even Cass herself is, like you say, recommending the kind of system that we have here in Aotearoa. If that's not a reason to, not want to pick up the review, I don't know what is.
Now, it wouldn't be a 1 of 200 podcast episode unless I'm going to take a crack at the media as well. But this, John, you said that we're not anything like the UK media, and it's pretty fair. But there has been a consistent, being incredibly charitable inability of media leadership here to keep some of the more uninformed or dangerously rhetorical takes out of their opinion columns, just for a starter. How do you fight back against a platform like that when a regular opinion columnist or a breakfast presenter or whatever just drops a piece of essentially disinformation around this, which, has happened more than once over the last couple of years. And I think has happened in a couple of places since the Cass review dropped as well, with the lack of either fact-checking or referencing that these people are being made to do by some of the top editors in the New Zealand media business.
There is a certain flexibility when you put an op-ed up and say it's an opinion piece. That means you don't have to implement journalistic rigor. There has been some reporting on Radio New Zealand by Ruth Hill, including one of a parent who's charged on puberty blockers saying, look, you guys just don't fucking understand this, which is great. But another piece which may be less good. But the rest have been opinion pieces, and they usually are opinion pieces. It's very rarely you get a hard news piece about this. except for David Fisher at the Herald, who did do some really nice work on it last year or the year before.
Mhm.
And obviously, Fish is one of the best journalists we've got in this country. And he gave everything a very fair hearing. Not in there is a debate, but he goes, here's what this actually is. Here's what it means. Now, that's one stream of it. However, there's the other side to this, which is certain trans activists who set themselves up as researchers are setting forward these opinion pieces using sources which come from mostly anti-trans lobby groups. So dubious provenance, but because it's got a link and the page looks good, that's accepted. However, should a news outlet publish the actual words of trans people receiving care or their experiences of puberty blockers or gender affirming care for youth, they are then subjected to multiple pages of complaint about that article to them. And then that will go to the Media Council as well, in a way which is flooding the field with shit, I believe is the phrase. I'm not sure if that was a Steve Bannonism from a while ago. Yeah, fuck, I hate that guy. But it's very much you have to spend your time first rebutting all of this fucking nonsense they give you, and then when it goes to Media Council, you've then got to justify it again to them. And it's an exhaustive process because they just keep on coming. But when we make complaints regarding these opinion pieces, we get told, no, it's opinion, sorry. And we don't kind of pursue it to the Media Council beyond that a lot of the time on the basis that we're just like, yeah, we know how this one goes. They're a lot more relentless in trying to get trans voices out of the debate that they say they want to have. Just like Angela said, they don't want trans people to have a voice in their care. They want cis people to make decisions about trans people's care. And as I believe Devon of the Trash Future podcast said, I wouldn't trust cis people with my fucking gender. I've seen how fucking weird they are with their own. And they are 100% correct.
100%. There's a few threads in there that's really worth pulling apart, right? And one is, that family who spoke to RNZ then had, spoke with just their first name, I'll add, then had their full name and photos blasted all over social media. Like Destiny Church reposted, Family First reposted, Speak Up for Women posted their name and face. Like any trans person or parent of a trans person who speaks out about this at the moment is exposing themselves to a really extreme level of hatred from people who have, made tangible threats of harm towards the rainbow community in the past. Like PATHA we have had to scrub, as much detail as we can of ourselves from the public-facing internet because about a month or so ago, Family First methodically published the name of every single member of PATHA's executive and policy and advocacy committees. Like, it's really extensive.
Shouldn't that be illegal?
HDCA.
Yeah, you'd hope so. We've had so many meetings with police. We've made net safe reports. We've done everything they tell you to do. But I think the state of personal safety for anyone working in this field at the moment is at a place where it's kind of not something you're able to police. Like practitioners who are working in this field are receiving vexatious complaints to professional bodies, not from patients they've looked after, but just from people who have an issue with their practice. Just having your name associated with gender affirming care is a professional liability at this point because of how obsessed some of these people are. And then
or just being transgender in a professional field.
Yeah, that too. Absolutely. Yeah. And then I think we have an issue with the Media Council as well. Obviously through all this process, we've been talking to reporters who are curious to know about what's happening what's happening at the moment. And we've been able to glean some interesting insights in that the Media Council, I think sometime last year, made a ruling against stuff in a trans issue around an issue of balance, and now at the very least stuff is incredibly cautious around how they report on things because they're keen to avoid any further Media Council complaints. And then the Media Council themselves, I think, really have to come to some kind of decision about two things, about what exactly is up for debate in the area of trans health, because they certainly have established ground, for example, around climate change, about what is established fact and what isn't anymore. And we saw the same thing with homosexuality in general. And then the Media Council has to figure out what the responsibilities are of media when it comes to reporting disinformation. I made a complaint to them last year after the Southland Times, which is part of Stuff, published a piece about changing rooms at a public pool down that way, where some members of the public went to a council meeting and repeated that myth that trans people are groomers and sex pests, and that letting them into bathrooms would cause harm and stuff. Just printed that material completely uncritically, claiming that because it was a genuinely held public view expressed in a public forum, then it was valid. Yeah, and the Media Council ruled against me. They upheld the article. They said, nope, that's a valid reason to spread that rumor, to spread that myth, because apparently if I walk into a council meeting and demand that everyone listen to me about how the sky is actually green, then that's a valid piece of information and needs to be published in a national paper.
So how do we, I guess going back to one of the things I was asking, strategically, maybe like from a comms perspective, how do we get around that other than just like beating away at it until they just happen to change their minds? Because it seems among all the reactionary and extremist lobbies, the anti-trans lobby has far too much fucking time on their hands. They're gonna be beating on that door far more than the rest of us are.
Well, I mean, they keep getting fired. Like, low blow, but I know of a number of people in the hardcore anti-trans lobby kind of scene who keep losing their jobs because they are slightly deranged about this issue to the point where they can no longer conduct themselves in a professional setting. So, like, not to be mean, but that's one reason they have all this time.
I think that's another conversation we have to have collectively as well, and that ties in so closely to all the other disinformation networks that we're seeing around, vaccines and climate change and 15-minute cities and everything, is that some of these people are so far down the rabbit hole and are really deluded. Some of these people are really intentionally generating fear as a means of amassing political power, but the vast majority of people are really genuinely concerned and genuinely worried, and their fear is being preyed on. And some of these people, you're totally right, Angela, like it really takes over their lives to a really extreme extent. And I can just imagine how scary it must be to be one of those people believing that behind every corner is a scary trans person who wants to come and get you. Genuinely, with compassion in my heart, some of these people genuinely need help and support. And I am interested in how we do that. But it's another thing in these areas where we haven't quite figured out the secret source of mass de-radicalization yet.
And just talk of that, because it is a process of radicalization, and it is a thing that people get into most of the time with if not genuine, honest concerns, I guess. And they get sucked into a media system that, continually cuts off their access and their relationship with things that are not self-reinforcing and so on and so forth. And I mean, for those people, I'm not sure, as you say, it's a broader conversation, isn't it? Whether it is anti-trans stuff, whether it is 15-minute cities or George Soros or any number of things. It is. So for those people, I'm not sure, I guess, what, how we push back against these sorts of things. But I think, in terms of everybody else, it is about trying to firstly humanize trans people. I know a trans person. Oh, my mate of mine who does blah, 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 who happens to be, and pushing back in our own communities when we hear, people saying shit that's real, just wild. And, going through, I can think of, colleagues and former colleagues who are working in the broader political space who I have very intense discussions with, just on a personal level, to try and push back, because it hasn't taken hold in the same way yet. and hopefully it doesn't, but it hasn't taken hold yet in the same way that sort of transphobia in the UK has become this almost like QAnon scale thing. And so I do think there is a lot of hope in terms of reaching people. And, the thing about you, Jen, being able to be literally world leading in the response to the CAS report, supporting organizations like PATHA and like Gender Minorities Aotearoa. I mean, giving your local trans person or alternatively me money. Like there are many things that we can do. And
Your local trans person.
Talk about sorts of really bleak stuff, but I guess trying to finish on a slightly higher note is that there is a lot of space, I think, in Aotearoa that is yet to be swung one way or the other. And so I think, focusing on the general, chats that you have with Uber drivers or people in the pub, like that is one of the ways. Supporting institutions again like PAPA and like GMA is another one of them, because thankfully things are not quite the state that they are here yet, and so hopefully efforts like those will suffice.
We do find ourselves in a position where we already have some legislation which is probably unthinkable in the UK. I mean, I didn't have gender self-ID being one of the causes of the resignation of the First Minister of the Scottish Parliament, but it's one of the contributing factors. But here we've got the legislation in place. We've also got a history of electing a transgender MP. New Zealanders respect tradition in good ways and bad ways. And if it is revealed that some of the anti-trans lobby genuinely don't think trans people exist at all, people are going to be like, well, hold on a second. That's a little bit too far now. But the queer community is a small community, although we're about to probably get some hard numbers this year on how big we are, because the census is coming out with the gender and with all the gender and sexuality questions. And that the first data release is the end of May. We are going to get the first picture of how big the community actually is, how big it is, how small it is. But actually having those hard numbers will be very useful in saying, why the fuck are you mad at like literally 5,000 people? Why are you trying to get laws changed for 5,000 people or less? Do you know what I mean? We're in a position where we've got some wins and we've got to keep protecting them. We're a small community, and like Jen said, threats to your life and your family happen if you get too loud against these groups. From personal experience, that's what happens. But there is no fucking way in hell I am letting Bob McCroskey and Brian Tamaki and other people who I will not mention get away with this shit. Because I left the UK 10 years ago and it's got a lot worse since then. I do not want this imported nonsense in this country. Transphobia is as bad as fucking possums, and we should run transphobia over with a car. The concept of, not the actual people, don't you dare contact the police, transphobes. But it's an imported pest, essentially. It doesn't belong here. And I think, as Angela said, there are more people in this country who don't care and who won't care at all than there are people who will go and paint over a rainbow crossing. And there are more people that look at that and go, that's horrible, don't do that. And that movement is coalescing, it is congealing together, that it's very hard for them to separate out and present themselves as the reasonable ones. Because everyone just goes, well, it's all the same thing, isn't it? You've all got the same intention. So there is hope. There's lots of hope. But it's going to involve getting a bit dirty, unfortunately. But, hey-ho.
There's so much hope. I was on a panel with Kate Hanna from the Disinformation Project towards the end of last year, and so it was about disinformation, rainbow communities, and hatred specifically. And the one mantra that has stuck in my head since, because it was so true and so useful, she said, I think someone asked why things were getting so nasty, at this particular moment, why things were getting so bad. And she was like, well, it's because we're winning. They can see, it's really obvious that we are on the threshold of achieving everything we want to achieve. And now they are pulling up every stop, everything they have to throw into this fight. And it's not going to work. It's as simple as that. They are a really small, really loud group of people who have really dedicated a lot of time to this. But just like we've said, there's a huge amount of people in the middle who are pretty ambivalent about it all, who can really see through their facade to how insane they are. And, this is how progress happens, is that we move forward and then it swings back a little bit, only to push forward again a bit further. So we're in that phase, but it's not going to last long. That's what I keep saying. Give it a month.
Give it a month and we'll be much better prepared, right? As well, though. So you've said that reveal could be dropping any day. What then? I guess you see what it says and respond as necessary.
Yeah, we finally will get to talk to Manatū Hauora about it, because part of this whole process has been zero input from trans communities, from PATHA, from clinicians working in this care. They've had 2 clinicians privately peer review the evidence brief, but that's kind of the extent of consultation that has happened. And so we are really looking forward to the opportunity of getting to talk to someone about it, and seeing what it actually says and kind of going through from there. But we'll keep doing what we're doing. We keep on working to improve access to this healthcare and improve the well-being of our communities. PATHA is currently got the contract to update our national gender affirming care guidelines. So that work will happen this year. We also have a contract to train Aotearoa's primary health workforce. So we'll be moving more and more to an informed consent model of care around the country. That's part of this 4-year contract is bringing on more prescribers. This is all stuff I can say because the anti-trans lobby are well aware of it by now. I just had my first quarterly report released in an OAA as well. I've really gone the full gamut from writing OAA requests to having to answer an OAA request to having something I've written released in an OAA request. But yeah, the work keeps happening. Like, all they're doing is adding to our workload, which I imagine is probably one of the aims of what they're doing, is to make life harder for us. But the work happens regardless. So they're doing all this work for nothing. Shame on them.
Well, we might wrap it there. Thanks so much for joining us, everyone. We'll do where can people find you and PATHA? Where can people show their support?
Yeah, you can find us just at patha.nz. If anyone out there is, working in the broad sphere of trans health and wellbeing and is interested in joining, membership is pretty affordable. I think if you're unwaged, it's something like $40 a year. You get access to a really nice email list server where people are sharing the latest kind of research and new resources and things that are being published and what's happening around the country. I think it's great value, and it's not just because I'm the president. Really worth checking it out as well. I no longer have a public-facing social media presence. That's a lie, but I'm staying offline as much as
It's not for this audience.
Yeah, exactly.
Don't go there, folks. just show support through the institutions that we've created. Thank you. John, our audience should know you by now, but where can you be found these days?
Old mate Cans on Blue Sky, posting that on TikTok. I'm very bad at TikTok because I'm nearly 40 years old, and I write almost exclusively for One of 200 as one of their most well-paid writers.
God, imagine if we had any money. Angela, do you want people to find you online?
Nah.
Angela is working on the black box gender transition machine and must not be disturbed at this point.
It's all under wraps. Hey, thank you so much, everyone, for joining me this evening to talk about these issues. We went over a little bit during the course of that discussion, but there's so little long-form discussion about this. We're dealing with fact and with what's actually happening in the community and in the wider environment. So good to sit down for an hour, just over an hour, and really pick your brains on it all. It has been... Even as someone who kind of keeps track of all the different social issues, there's a lot there that I wasn't aware of, and I hope our audience, you've been able to learn a lot from that as well. So go and find people online, go and find PATHA. If you think people would benefit from this, hearing a bit more information about what's happening in the trans rights space and with trans healthcare, share it. Let people know that there is independent media out here that's trying to platform voices that we're not often getting in mainstream media. That's been another episode of 1 of 200. Like, share, subscribe, etc. I'll put links in the summary to all the things. We'll catch you on the weekend.
If artifice is art, then I'm living a pointless life, but I'm learning all your lessons. Fucking politics, there's no distinction. The road's apart now. It's paved with good intentions, and I'll admit that I'm at a loss for what to say when they quote this as a cost we ought to stay. 'Cause I live amongst the people every day in this vindictive, forgetful fucking rain. It feels like we're